Every day, people around the world receive evidence-based interventions or medications that fail to produce the desired effects. Evidence falls short in the individual case. The reasons are manifold, such as belonging to a particular ethnic group or gender. It is well known that the classical experimental design reaches its limits. Nevertheless, it is still considered the gold standard in health research. From a practical standpoint, nursing care for individual patients often leads to a sense of directionless emptiness despite impressive scientific knowledge. What does the focus on large groups and the comparison between control and intervention groups and their results have to do with the specific case entrusted to me? The results of such studies are averages. However, the patient in everyday clinical practice is an individual who, by definition, differs from the average. In recent years, personalized medicine, also known as precision medicine or individualized medicine, has gained significance. In complement to the current professional routine of healthcare professionals, such as advanced practice nurses in the role of nurse practitioners, the focus should also turn to the ability to perceive and understand the individual case. Illness situations, disease trajectories, and the associated single-case interventions represent a whole new challenge for this role and its related responsibilities. Case-based research is subsumed under the label Case Study Research, CSR. All types of case study designs are included under this term: qualitative, quantitative, or mixed methods. Anyone who merely thinks of case reports at this point should quickly become aware that the scope and depth of case study research are much more nuanced than often assumed. A key characteristic distinguishing CSR from other methodologies and designs is that it starts primarily from the case itself, while the phenomenon to be studied is considered secondary or is the background. The spectrum of CSR ranges from descriptive exploratory design approaches to explanatory quantitative studies and even hermeneutic casework. CSR can also include so-called N-of-1 studies, which so far have had little significance in nursing research. Nurse practitioners play a crucial role in advancing a more nuanced, person-centered logic in care delivery. Their ability to perceive, interpret, and respond to complex evolving clinical scenarios necessitates matching research strategies. Case study research, as well as N-of-1 studies, emerge as essential tools for professionalizing advanced nursing roles. While case reports merely describe single clinical experiences, qualitative case studies provide in-depth, context-sensitive insights. However, it is the N-of-1 study that rigorously evaluates what truly works for a particular patient through structured, often repeated comparisons of interventions and outcomes. This design transforms trial and error into a systematic inquiry, removing the arbitrariness often associated with individualized care attempts. By adopting N-of-1 methodologies, advanced practice nurses not only improve the transparency and credibility of their interventions, but also create reproducible knowledge from within practice. The ability to document and justify clinical decisions in complex cases fosters both accountability and learning. Moreover, such competence supports the broader aim of person-centered care, to tailor interventions not merely to categories of disease, but to the lived reality of the individual. In this way, APNs become pivotal in bridging the gap between general evidence and personal meaning, advancing a responsive, verifiable, and ethically grounded nursing practice.